Morning. Hi, I'm Devraj, orthopedic surgeon here on the North Shore.
And Charles Schumacher, also orthopedic surgeon with Covington Orthopedics here on the North Shore. We're coming to talk about a case today, one of Dr. Devraj's patients. A very special case and something pretty rare that we did on the AVALA campus here.
So this young man came to my clinic several months ago. Happened that I had taken care of his father a few years earlier, and his father had a hip replacement by me and had done well. Had walked again, got out of pain, and had been doing really well. Well, his son, who is young, is only 30, was born with a congenital hip problem and was noted as a teenager to have a pretty significant hip deformity that he had struggled with, and it had been over a decade that he'd been having pain and limitations. He wasn't sure really where he would go with this, but every day it was an influence on his life. So when his father went through hip replacement surgery and saw how successful it was for him, how it opened up, a whole new realm of possibilities for him and things that he could do day to day, the son came to me and presented me with this somewhat rare case in the fact that here he was, a young man of 30 with two terrible hips that were really giving him limitations, from a day-to-day standpoint.
Yeah, he had hip dysplasia where the socket of the hip didn't develop correctly as a child, and therefore he developed onset of arthritis or wear out of the hip very early in life. So over time, his legs actually shortened almost 2 centimeters on both sides, and he completely wore his hips out where the ball was working its way out of the socket. So with that, he had a lot of trouble walking, ambulating, and it's a very common cause of arthritis.
So for somebody like that, the two concerns we had obviously is his young age. Being young and having a hip replacement we recognize is not ideal, but his quality of life influenced his decision. The other part of it was recognizing how short he was. If we had staged his hips and done one and then come back at some point in the future and done the second, there were some concerns about how his gait would have affected over those course of periods of weeks or months until he had a second hip replacement. And so the decision at that point was made to say, although rare, for him, doing both hips at one time seemed the best medical decision making at that point. So at that stage, I wanted to get involved with Dr. Schumacher, a very good hip surgeon, and to talk to him about doing this working with both physicians at one time.
So when you do both at the same time, it used to be very common with knees, but is now not happening as often because the risk goes up. Your time under surgery goes up, and complication risk could go up. And so working together, and then we use the robotic technology to help us. In his case, because he had shortened so much, and we needed to really accurately gauge how long we were going to make his legs to protect his walking, his ambulation, and his nerves to his legs. And so working together, we were able to do both of his hips here at AVALA and get him up walking.
And so, like I said, not something that we do commonly, but for him, again, ideally, for him, it was the best choice for him moving forward. And we've been very happy with, what we've been able to accomplish with him. Even the nurses on the floor were so surprised when this young guy got up the next day and was walking down the hallway and on his walker, and I called the next afternoon to come by and check on him, and they said, well, he's on his way out the door. And so that's tremendous. Obviously, he has a lot of work ahead of him over these next several months to get stronger and really learn to walk again, because this is what he's dealt with his whole life. But he's doing great, and he walked into clinic a couple days ago, and he looked fantastic.
An inch taller. So we lengthened him, and he walked out of the hospital the next day.